Toronto hitting a new vaccination record this week as the city works to get second doses into arms. The 7-day average, now over 44,000 total doses per day on average. That's amazing. And a sign that it's working, for the first time since the pandemic started, the Toronto General Surgical ICU unit, that is COVID-free. We'll show you that video in just a sec. Right now, Mayor John Tory joins us live for a lot of this good news. And I want to start with the good news because often it's the negative, Mayor Tory, but let's start with all of those numbers. That is significant. There's positivity, that's for sure, with the doses getting into arms. But you say there could be a little bit more done.
Well, I mean, we're limited strictly by supply. I mean, we don't book an appointment or open a clinic unless we have a dose to give somebody. The pop-up clinics are a little bit different because they're not based on an appointment. They're based on people, showing up when they pop up, as it were. And there's a mix of both. I mean, the city-run clinics have put tens and tens of hundreds of thousands of people through with appointments, and there are no lineups, and they've worked very well. And we could have, the city clinics are operating right now at about 90% capacity, so there's 10% more capacity that was built in from the beginning, but we will not make available an appointment unless we have a dose of vaccine to go with it. That just makes sense. We don't want to book an appointment, have someone show up, and then say, terribly sorry, we don't have any vaccine. So increased supply, and the province has been good about recognizing through the pandemic and through the vaccination phase that this is a place, Toronto, together with a couple of others, which are deserving of an increased amount of vaccine, because that can cause these kind of hotspots where there's still a greater risk of people becoming infected to allow us to address them with greater supply. And so I hope if they could consider doing that again, and maybe the minister will have something to say about that today, that will allow us to offer even more appointments and vaccinate even more people.
Let's hope so. There is a push to bump up the reopening for stage 2. We heard from Mayor Patrick Brown earlier on saying definitely for personal care services who've been waiting, and it would be naive to say that some people aren't going to backyards or garages that are already getting those haircuts. Are you behind that push as well? Would you agree that certain things like personal care could potentially reopen even earlier?
Well, I joined the other mayors earlier this week on Monday in saying that the province should be continuously reviewing the numbers. I mean, they put forward a plan this time which had certain elements, and then you can't start taking the plan apart. Getting us healthy and making sure we do it in a proper, cautious way involves sticking to the plan. And I think their plan was a good plan, but we did say, all of us as mayors together on Monday, that if the numbers warranted and if all the circumstances warranted, then they might take a look at the personal services business. I mean, I'm one of those people who's waiting for the professionals who can look after my hair as opposed to having it done in a backyard or in some sort of underground way. I want those people desperately to be back to work for their own sake, let alone mine and yours and everybody else's. But I think we just have to make sure we do this carefully. So I'm confident that the public health people will talk to the Premier and that he will make the right decision, whatever that may be. I want things open, as many things open as soon as possible, just like everybody else.
Very quickly for you, I've got about 30 seconds left, at least for this portion. Cafe TO seems to be a lot of positive response to it. Do you foresee this going long term?
Totally. I mean, that's my wish. I want this to become a permanent program, and we've refined it from this year to last year to this. We will continue to refine it. We continue to expand it, but I see it very much as a permanent part of the city landscape, pandemic or not. This is just a good thing for the city. It's a good thing for those businesses, and they'll take some time to recover those businesses. They were, dealt a huge blow that will take more than 1 year. So I would like to see it made permanent, and maybe what we'll do is have a look after this year to say, all right, in the context of a permanent program, what changes would you make to make sure it's safe and to make sure it works for everybody? So yes, I'd see it for the long term.
Okay, lovely. 7:09 is the time right now, Mayor Tory. It is it for me here. You're joining Dina and Sid with something amazing. You're going to love it.
Okay.
Okay.
All right.